Welcome to the Chow Podcast, hosted by Animal Friends of Wyoming County, where our mission is to help care for animals held by the Wyoming County Animal Shelter and promote responsible pet care in Wyoming County. Thank you for joining us. Hello, everybody. Welcome to the Animal Friends of Wyoming County Chow Podcast. To our listening audience, we might be making little references here or there that are a little bit different than normal. It's because for the first time, we are recording our podcast video-wise, too. Video-wise, is that the right way to say it? Video.
You could say we're video recording our podcast.
Video recording. Yes, we are video recording.
Just audio. Yeah.
Yes, ma'am. Thank you so much. As you can tell, I need some help here. So, without further ado, let me just explain to you, if this is your first time tuning into the podcast, who we are. Animal Friends of Wyoming County is a 501c3 nonprofit organization in Wyoming County, New York, with the sole purpose of spaying, neutering, and getting medical needs taken care of for the dogs at the Wyoming County Animal Shelter and promoting them and sponsoring them for successful adoptions, as well as education in our local community. So this is part of our education wing, our CHOW podcast. CHOW is an acronym for Canine Health, Ownership, and Wellness. And the whole purpose of this is to bring on special guests and professionals in their fields to talk about the issues at hand that affect our community and have greater knowledge at large for how to care for our companion animals. So, to segue that over to this episode, today we're going to be talking about senior cats and how we're supposed to care for them. Before we start talking to our special guest of honor for today, I want to introduce one of my co-hosts. This is our first time joining the podcast. Her name is Miss Trisha Ripple, and I'll let you tell the world who you are.
Thank you, Sam. Hi, my name is Trisha Ripple. I am currently on the board for the animal shelter. I'm the events coordinator. We do different events throughout the county to raise awareness, to raise funds, to help support the animals that we have here. I've been doing this I'm kind of new to it. I've been doing it for a few months. I have 2 dogs and 2 cats of my own. They're my children. I'm glad to be here. I'm glad to be part of this today. Thank you.
Thank you. Well, I'm glad you're joining us for the first time on the podcast part. This is very, very, obviously when you watch me and how I do this whole thing, I am very enthusiastic and excited for this because I really do think this is a passion that not only I have, but I think our community needs to hear of what goes on locally and how to care for our companion animals, and that we have such amazing people locally to talk about this stuff, such as our special guest of honor today. So I really feel that this is an important endeavor that Animal Friends has taken on. I'm so blessed and thankful for people like you, Trisha, and other members of our board that are spearheading some of our projects, programs, and fundraising to help us keep things going. So to segue on from here, let's introduce our special guest of honor today. So, Dr. Jenna Hill-Smith of the Perry Veterinary Clinic, please introduce yourself to our audience.
Great. Thank you, Sam. So my name is Jenna. I became a vet 5 years ago. I graduated from Cornell and then came to Perry. Right now, I do a mix of both small animal and large animal, so I get to see all species. It's a really fun job, and I'm excited to talk about cats today.
Awesome. Cool. Well, thank you so much for coming on board and joining us in this endeavor. This is the first time Animal Friends is talking about cats, because we primarily... Not that we're not cat people. We have plenty of cat people on our board, but the Wyoming County Animal Shelter in particular deals with canines. Mm-hmm. So to expand upon that, to accompany all companion animals, including cats, is very important to us too. And this is where your knowledge and expertise in the cat world is going to benefit us and our audience greatly. So thank you for joining our group. Mm-hmm. I've had the blessing and the privilege of working with Dr. Hill at the Perry Veterinary Clinic. She is one of my favorite go-to doctors. I'm always excited when I go to work. I look at the schedule. I'm like, oh, Dr. Hill is here. Oh my gosh, this is going to be a good day. So thank you. So All right. So, what are some of your hobbies that you like to do outside of work?
Oh, yes, hobbies. So when I'm not working, my husband and I like to go hiking, bike riding, that sort of thing. We have 2 cats, of course, and a pet goat and a Jersey cow at our house right now.
Oh, so cool. And you said you do a mixture of both small and large animal.
Yes.
So, in what capacity?
Yeah, so it's a pretty even split 50-50. So a couple days a week I see appointments and do surgery in the clinic, and then a couple days a week I'm out on the road going to farms and seeing large animals.
I'm sure not that I'm not going to ask you what's your favorite because I'm sure you have a favorite in both sides of it. But in particular for cats that we're talking about today, why is this such a passion for you, do you feel?
Oh, so I found that I am a crazy cat person. Turns out I love dogs as well, but I really enjoy cats. I think they're a very unique companion. And in the vet world, you know, they're really good at hiding their issues. So they're kind of a diagnostic challenge. I have 2 cats who I just adore. And yeah, I think cat people are often really fun to get to know. So, yeah.
Yes. Yeah. I mean, when we talk about cats and comparing them to dogs, within New York State, I'm just thinking about this in the lens of like animal control and what I've done here at Animal Friends perspective. They're not as probably the best way to say is controlled as dogs are when it comes to things like there's no cat licensing in New York State except for 2 places in New York State, by the way, that have cat licensing. I can't tell you off the top of my head what the second place is, but I believe Syracuse is another place that actually has cat licensing, which is
That's interesting.
very interesting. And I'll be petrified if it comes to
wonder
Long
how
County.
they actually follow through with that and actually can keep control of the cats.
Yeah.
Yeah, well, that's a very good question because we see in our communities where there are a lot of stray cats sometimes, and it's hard to maintain control of their reproductive organs, the whole thing to keep the population under control for cats. So we don't have this flood of issues in small villages and towns of the neighborhood cat now has 10 kittens, and then they just keep going and going and going, and no one takes care of them, things like that. So animal control sees a lot of cat issues here or there, even though we can't harbor cats at the Wama County Animal Shelter. So, in particular, what we're talking about to narrow down our topic even more than just the feline species, we're talking about our geriatric felines, our senior cats, to put it in the nicest way possible, our cats at that stage of life that may need a little more extra attention and care from owners. So do you want to start the conversation talking about cats and the senior cats in particular?
Sure. Yeah, so as cats age, once they get up to that like 12 to 14 years old, we consider them seniors. Lots of different changes, just like with any other species, lots of different things that you can see. Often when I'm seeing people for appointments and we have an older kitty, we have a conversation about, has there been a change in weight? Has there been a change in mobility? Change in drinking, anything like that, make sure everything is still going well. If there are changes, we talk about what testing can we do to try to narrow down, do we have a problem or are we good? And yeah, important to bring your cat to the vet so we can kind of try to figure out, is there anything going on that we need to address?
Yeah. So when you start looking at senior cats in the vet clinic, when they reach about like the 9-10 years of age mark, where they're moving away from their adulthood, so to speak, and into that, how do I properly say this? It's I don't want to say final stages, but it kind of is. It's the senior, the elderly part where
The next stages.
the next stages of life. Yes.
Yep.
What are some of the things that you look out for in particular when you're examining them?
When I'm looking at them. Yeah, so a big thing that I look at is their weight. So have we gone down a pound or two since our last visit? Are there areas that the owner has noticed? Like when I pet this cat, I can feel the ribs really easily, or I can feel all of the hips really easily. Weight loss is a big one. Sometimes you'll see, if they're having some mobility issues, maybe we're not grooming as well. Maybe we're getting some mats, maybe the cat is really spicy when I touch a certain spot. Maybe that spot hurts. And just like all your regular stuff on the physical, like is our heart pounding really, really fast? Are we dehydrated? When we palpate the belly, does something feel off? Anything like that. And usually from a physical, we can kind of get a starting point, decide what route we need to go with diagnostics, and then figure out what to do from there.
Okay. Yeah, so in regards to diagnostics and some of those extra things that we look out for our senior cats, you had 3 main areas of concern you want to highlight in regards to senior cats, right?
Yes, yeah. So the conversation I usually am having with owners is, the big things to look for as your cat gets older. Is our litter box getting soaked? Are we drinking a ton of water? Is that changing? Are we losing weight? Are we gaining weight? And how is our appetite? Are we losing weight despite eating a lot more? Are we acting like we're hungry all the time, up on the table, getting into loaves of bread, things like that? Because any of those signs kind of, are a red flag that something metabolically may be going on. And kind of the 3 diseases that I usually talk about, which is not an exhaustive list, but kind of gives us the 3 big ones, would be like diabetes, hyperthyroidism, and kidney disease.
Okay, so let's segue right into that for the diabetes aspect of it. So explain to our audience, because I'm sure everyone is aware of what diabetes is to a degree, especially when it comes to humans, but let's narrow it down more specifically for felines. How differently is diabetes from animals, in particular cats, to humans?
To humans. Yeah, so diabetes, you most commonly you aren't responding to insulin, or you're not creating any insulin, and so your blood glucose is getting just way, way, way too high, which makes you feel like you ate, 100 Snickers bars and you don't feel very good. Some cats can go into remission. We can get them out of that diabetic crisis and back to normal. But usually I mostly just explain it to people. It's pretty similar to human diabetes. So in order to diagnose it, we want to check our blood sugar, see what it is. If we are 10 times the normal limit, we are pretty darn high and something is probably going on. And we often look at some urine as well, as that will show signs of our blood glucose being way too high. Signs people might see at home. I think the big one is cats are drinking a lot of water, and then the litter box is really, really wet. And usually quite a bit of weight loss. So as far as treatment goes, there's been some new things that we can do here in the last couple of years. The main thing is giving insulin injections. So that is usually not too challenging. It's a really tiny needle, really tiny syringe, and cats tolerate it really well. There are now some oral medications that we can use that help just excrete that extra sugar and keep our blood sugar normal. So a really treatable disease. Sometimes it can take a little bit to kind of get things under control, to figure out the right dose where we're keeping our sugar low but not too low. And yeah, usually we get a pretty good response to that.
Now, is it common for older cats to get diabetes, or is it just kind of a cat by cat?
Yeah, so it can really be any age. I lumped it in with this because when we're talking about, a cat that's drinking a lot, losing weight, which is usually an older cat,
Yeah.
one of the things we're thinking about is diabetes. But any cat, any age, this can happen to, certainly can happen to older cats. So.
And diabetes, if not treated properly, how debilitating is that usually for cats?
Yeah, so if your blood sugar stays way too high all of the time, you will end up with those diabetic cataracts, so, the totally white cloudiness in those eyes. But lots of other issues, that messes up your blood pressure, it messes up your perfusion, just like in people, when you have all of those issues, same types of things can happen to cats. Usually they lose so much weight when that blood sugar is so high.
I had a friend who had 2 diabetic cats, and I got the pleasure of giving the cats the shots.
Oh, yes.
They actually, they weren't too bad. Like,
Yeah.
you just had to get the cat in the area where they couldn't take off from
Yes.
you. Like, as soon as I caught them, like, they did tolerate it. It was a quick, simple shot, and then they were done and fine. And there were never any adverse reaction that I ever saw a cat. So,
Yeah.
like from my experience of doing it, it seemed really simple.
Right. Yeah. No, it's not too bad to give a cat insulin, and if you're really gung ho, you can do lots of positive reinforcement, kind of get them used to it, things like that. So.
Yeah. Do you usually see, like in small practice that you work in, diabetes becoming very prevalent for senior cats, or is this just one of the warning signs?
I would say, we certainly see quite a bit of it. Overweight kitties are a little more likely to develop it, and we certainly see our fair share of really chunky cats. So important to keep your cat at a leaner body weight.
Yes, we had Dr. Kate Capel in early on.
Yes. Oh, her podcast was great.
Thank you. Yes. Oh, she was fantastic. I enjoyed every moment of her video and her podcast.
Yeah.
And she really dived into the different diseases that can come from or be contributed to overweight
Right.
and obesity, and diabetes definitely is one of them. So I'm glad you're touching upon that today to get more in-depth detail for cats. And because they're senior cats, would you say that these diseases that we're talking about today, for them in particular, they're more susceptible to because their immune system, or because they're just older?
Yeah, so some of it is just like straight related to the processes that change as you age. Usually, so the next 2 that we're talking about are definitely associated with older kitties, hyperthyroidism and kidney disease. So.
Yep. And I'm just looking on here for our listening audience. I have in front of me some references I've been using when I've been preparing for our episode today and our conversation with Dr. Hill. And the one article I have here is from Cornell University that talks about, by the way, all of our references that we're talking about today are available on our website, animalfriendsofwyco.com, under the Chow Podcasts tab. So if you're listening to this and you want to read what we're talking about or more in-depth detail, I will have all these links available for you once this podcast launches. So this one article I'm reading in particular is from Cornell University, and let's see, it says about 75% of cats affected have an insulin-dependent type of diabetes that will require insulin injections, and diabetes occurs most often in middle-aged to older cats, with male cats more prone than female cats, which is a very interesting fact. Is that due to hormone imbalance? Is that due to, do you know any way to elaborate on why do they affect them more?
Nope. I don't know why it affects male cats more. But
Yeah, it's just very interesting that when you start to read up on diabetes in particular, and actually every disease that we're talking about here, with cats. So definitely ask your veterinarian if you have a senior cat or a middle-aged cat, I guess, even, to see how prone your cat is to developing one of these types of serious diseases. To segue from diabetes, you wanted to talk about hypothyroidism. Is that right?
Yes, hyperthyroidism. So, hyperthyroidism, very common in older cats, your classic ancient cat that's very thin and is getting into all of your food, getting up on the table, opening your bread, eating anything.
My kitten does that still.
Still.
Knocks everything down.
Yeah. So that when they have hyperthyroidism, that means they are just making way, way, way too much thyroid hormone, which kind of governs your metabolism. So that's just cranking up the metabolism, and they are burning so many calories, which is why they are so hungry. And it can cause other issues as well. So testing for that, we draw some blood, check our thyroid level. If it is high, and the cat looks like a hyperthyroid cat, then usually we have a conversation about different types of treatment. There's a handful of different ones you can use. Some oral medication, some transdermal medication that's absorbed through the skin, prescription diet, or...
Now, is it curable, or is it something that they're always going to have, just we have to manage it?
Yeah, so generally, one type of the treatment, if you were to do radioactive iodine therapy at a referral hospital, that would be curative.
It's very expensive.
Generally, most people do not do that. So our other medications are just kind of getting our thyroid level down into the normal range, and alleviating all of the symptoms that come with hyperthyroidism.
Interesting. Yes. And how would you differentiate hyperthyroidism in cats versus dogs? I only ask because I'm a little familiar with hypothyroidism, given I have a dog.
Oh, yes.
I guess now he's considered senior. He's turning 9 years old in September.
Yeah.
So
dogs get hypothyroidism and cats get hyper.
Okay.
So dogs are too low and cats are too high.
Is that the general consensus of when that happens? Or
yes.
Okay.
Yep. So it could happen the other way, but it would be super rare, and your vet would be really excited about it.
Something new.
Yeah. But yeah, generally dogs are too, if they are having thyroid issues, they are too low in thyroid hormone, and so they're overweight and lethargic and heat-seeking, all of that. And then your cats are too high in thyroid hormone and turning very thin and getting kind of a matted coat and all of that. So.
Okay, so those are sort of the signs. Thin,
Yeah.
coat.
Yep. Weight loss, unkempt coat. Sometimes their claws will grow really, really fast just because of that metabolism. Ravenous appetite, sometimes some diarrhea. All the things you don't really want.
Yes. Yeah. And I guess I did not know this until I was doing my research on this, but hyperthyroidism in cats has the greatest risk of hyperthyroidism. Actually, 95% of cats with hypothyroid disease are senior cats over the age of 10.
Yeah.
Why is that such a high number for cats? Is that because they're a senior cat in particular?
Yeah, yep. So this one is just related to their age. So most hyperthyroid cats, so the thyroid gland, similar to us, it's like right there. A lot of hyperthyroid cats have tumors on that thyroid gland that is making them produce too much thyroid hormone. So kind of it very related to their age.
And in a case like that, where if you find that they have developed a tumor, is that something that either the tumor itself gets treated, or you're just treating how is that treated? Is the tumor removed? What's the...
Well, the medications that we use are just like shutting off that thyroid hormone production. We don't want to shut it off all the way, but we want to get rid of all that extra. So it's not doing anything to the tumor, but more what the tumor is making.
Okay. And if they should develop a tumor, are surgery an option for something like that, or because of the location?
Yeah, it's kind of a dicey location. That would be more of a referral thing. I would say like 98% of clients that I see with hyperthyroid kitties opt to do either oral medication transdermally on the ear, or the prescription diet.
Yeah. Well, it's also worthy to note too that when you're talking about like surgical operations too, it not only just in these conditions, but the cats, in particular, we're talking about our senior cats.
An older cat, yeah.
So I know that the vet clinic usually has like a senior animal cocktail when they have to anesthetize an animal, but to put them through a surgery at their advanced age.
Might not want
Yep.
to, right.
There might be a lot more complications than anything.
Yes.
Yeah. I totally understand. So we talked about the signs of hyperthyroidism, and some of the various treatments. You mentioned medication. There is something special with what, iodine, you said?
Iodine, yeah, yep. So they can do at a referral place. In New York, you'd probably go to Cornell. They can do radioactive iodine treatment on the thyroid to
That is very interesting. I've never heard of something like that before.
get rid of all those hyper parts. So,
Interesting. Yeah, well, definitely. What type of blood work is usually run to test for thyroidism?
yeah, so we usually like to do a full CBC chemistry with a thyroid level. And the thyroid level specifically is what's telling you, hey, our thyroid is way too active.
Okay. Let's see here. So, is there anything more on hyperthyroidism
Hyperthyroidism.
we haven't touched yet in regards to senior cats?
Once you start, so if you do medication, once you start that, we got to check back in, check our blood work again in another few weeks, and make sure, similar to diabetes, make sure we're at a good spot. So, and then depending on your lifestyle with your cat, either pills or the one that's transdermal or the food, you can find something that works for you. Generally, these guys respond pretty well, and we always get so excited when they come back and they've gained 2 pounds and they have some muscle and they're grooming again and they don't have diarrhea and they're not getting in the cupboards. So.
Good. Yeah.
So the kitten phase turns back into a kitten phase, basically, when they have
That's a really good way of putting it for hyperthyroidism. So after hyperthyroidism, you want to talk about kidney issues and disease.
Yes. Yeah. Yep. So older cats, the kidney can kind of just. So cats have 2 kidneys. As they age, they can kind of just lose how well they work and kind of, lose that ability to filter and concentrate urine. So a lot of times we can notice that on a physical exam. You should be able to feel the kidneys. And if you can't feel kidneys, that could mean they are really, really small. And so if they're really, really small, the cat has been drinking a lot of water like our other diseases. The litter box is soaked. Maybe we're losing some weight. Maybe our appetite has changed and we're not eating very well. Kidney disease would definitely be on my radar. The nice thing, so if you're running like annual blood work for older kitties, something like that, you have an idea of what their kidney values are and you can, stay on top of something like this. Treatment for kidney disease, well, backing up, we diagnose this with blood work. There's different kidney values on there that help us decide, do we have a kidney issue? And then it's always good to have a urinalysis as well, since the urine is the product from the kidney that tells us a ton about how the kidney is doing. Those two together help us stage the kidney disease. Depending on what stage we're at, there's different recommendations. So lots of different things we can do to help manage this disease. We want to get on a special food. There's different medications that's probably beyond the scope of this podcast for things that you would do depending on this stage. But the earlier you catch it, the better they respond, and the more longevity you get for those cats.
Nice.
Yes, because kidney disease, urinary issues, UTIs, things like that, they definitely are very ravenous when animals of any age and any species get it. But when it comes to our senior cats, how susceptible they are, their immune system is a little bit weaker.
Right. Yes.
And in particular, if I remember right, it's male cats have a tendency to get blockages more often.
Yeah, yep. So that would be kind of a separate thing. But yes, male cats and their lower urinary tract issues, they can certainly develop some blockages.
Yep. Which, if that does happen, that is very fatal and dangerous. And if you suspect that your senior cat or your cat in general, even if it's not a senior, is not urinating appropriately, call your veterinarian immediately, because most of the time they would want to make sure it's not a serious and dangerous thing occurring. So from that, what other kidney diseases do you usually notice with elderly cats?
Yeah, so when we talk about kidney disease in older cats, we're just saying like the kidney as a whole, the kidneys as a whole are not functioning well, and we're losing that filtering and that concentrating ability. They can get infections ascending up into that kidney, but generally the most common is just that age-related atrophy and loss of function. So.
Yes, yeah. So, I'm actually kind of glad that you are doing a podcast on senior cats in particular, because I think it's important to highlight that not just with cats, but even with dogs too, growing old is not a disease. Growing old is not an issue. It's the things that come about when we mature. You know, as people, we go through the same thing. We hit a certain threshold in life, and we're like, okay, I gotta start doing a colonoscopy. I gotta start doing this. I gotta start doing that.
Start exercising more, so you don't gain all that weight because everything settles.
Yes. Our metabolism doesn't act like it used to, and things like that. So
the cat's bodies changes just like our bodies change. Yep.
Exactly. Yeah. So for us as cat owners, we need to be more aware of, okay, our cat has reached that threshold. Now let's have a conversation with our veterinarian on what our cats are now more susceptible to.
Exactly. Yeah. And I will occasionally run into cats where they've lost a bunch of weight, and people say, well, they're just old, and I'm like, well, there's a reason why. There's probably something underlying that's making us lose weight.
That's a very good point. Yeah, because as we just stated, getting older is not the problem. It's the things that come with it. So when your cat is elderly and looks frail, just
why?
Still,
Yeah. Find out why.
Yeah.
Because old age is not the disease. It's the things that are surrounding it or contributing to it. So, and I think it's been very, very cool. I read a study that said, and please verify this if this is accurate, at one point, senior cats, their lifespan was between like 8 years and 14 or something, and now they've, thanks to modern medicine and the advancements in society taking care of cats more appropriately, their lifespan has extended to 22, 24. Like their lifespan has gone up.
Yeah. 22 I've seen once, but the lifespan has really increased in cats. And I guess earlier when I say cats are seniors at 12, like that's they're definitely seniors at 12, but even a couple years before that, thinking about paying good attention to them. But cats are a long-term commitment.
Yes.
You get a kitten, you will have that kitten for a while if you take good care of it. So
Yeah, well, that's another key point that I know you want to definitely touch upon and hammer out, is that take care of when you get a companion animal, a cat, even if it was a stray cat or it's a barn cat or things like that, still take it to your annual physical with your veterinarian. Make sure you have the tests run that need to be run for their age at the appropriate time. Be up to date on vaccines because the rabies shot is required by law, so you really can't get around that one. But I mean, there are other diseases. We talked about one earlier today about feline leukemia that cats in general are susceptible to, and I'm sure with senior cats, when they're older, their immune system is not as pumped as it used to be.
Yeah.
So be mindful of that too. Which actually, since is there any more about kidneys that we want to talk about?
I think that's pretty much it. Yeah.
Yeah, so moving on from kidneys, those are just the three main things that Dr. Hill wanted to talk about today regarding the signs and things to look out for when your cat reaches that senior age threshold. But they still are susceptible to other illnesses and diseases. And so let's talk about their mobility.
Sure. Yeah, so definitely arthritis and mobility issues are a big one for senior cats. People will often remark like, oh, he's not getting on the table like he used to, and they're happy about that. But that means that he probably is a little uncomfortable and he can't jump like he used to. You know, maybe he has some osteoarthritis starting in those hind limbs and in the pelvis, and he can't spring up like he used to. So there's all sorts of different mobility scoring that you can do, but usually I talk to people about, you know, did your cat used to jump onto the windowsill and now it has to get on the chair and then get to the windowsill? When it's running up the stairs, is it doing a step at a time instead of that cute little cat trot? You know, is it trying to bear weight a little more cautiously? If you have your food and water like in the basement, have they lost weight because they don't want to go down the stairs and come back up? And a lot of times when we're feeding cats like in a dish right on the floor, they have to bend quite a bit to get down there. You know, those little cat elbows are having to flex pretty good to get down. So when your cats are having mobility issues, certainly giving them a little elevated dish so they can just lean and eat is so much nicer. The ways that we kind of check out mobility issues, so a lot of it is talking to the owner. You know, sometimes people will have videos of them, you know, doing a weird jumping thing or limping or walking funny. So if you see anything weird, you know, take a video. Anymore, we can put it on slow-mo and really watch it really well.
I love modern technology nowadays.
Yeah.
All that stuff.
Yeah, no.
It does help.
We love to see videos and pictures of stuff, all sorts of stuff at work. So, yes. So a lot of it is visual, and then like your physical exam where we're just kind of, you know, feeling all of our joint movements, seeing if there's any spot that is really uncomfortable, any spot where there's poor range of motion, anything like that.
Yep. When you're looking at mobility and things like that, not to jump into what your thought was, but arthritis definitely comes to mind when we think about ourselves when we get older and cats when they're getting older. How do you usually look out for things like that?
Yeah, so a lot of it is the physical exam, and then we can take x-rays and see changes in those joints, you know, little changes in the cartilage, changes in the whole flexibility of the joint capsule. And a lot of it is what the owner tells us about, you know, you can't get on the counter. You can't run away from the dog anymore. Things like that. So.
Yeah, and so we touched upon their joints and their muscular structure. And how about their skin? What do we notice about their skin that's different?
Sure. So sometimes they lose a little bit of that elasticity, just like people. Often, which this kind of goes along with the joint pain, they aren't grooming quite as well because it might hurt to bend all the way back. and reach back there. So certainly if you're getting mats and stuff, little tufts of fur all stuck, best to get that with clippers, not with scissors, so you don't cut the cat. But yeah, we see little mats like that. And sometimes they will get a little more dry skin as they age. And there's different supplements you can use for that.
Okay.
So as far as treatment of mobility issues, just like with dogs, we often start with joint supplements. So your vet can recommend some of those to you. Keeping them at a healthy weight is key. It's hard to move if you're lean and have arthritis. It's really hard to move if you're obese and have arthritis. So you want to stay at a good body weight. And then we have some newer medications, some injections that we can give cats for arthritis pain here in the last year that we've seen good results with.
Good.
So.
Good. Yeah, I think the weight is a very big,
the weight's
big detail.
A huge one.
Yep. If you could keep the body weight off, you're preventing a lot of
issues. Yeah.
Yes. Exactly. Yeah. So from there, how about we talk about their mental factors a little bit, their cognitive functions, things like that.
Yeah. So I feel like as they age, they are a little more prone to things stressing them out. So, trying to make it so they have kind of they have usually a pretty easy life, but, an easy life. So they don't have to climb somewhere really high to get their food. They don't have to jump over a baby gate to get into where the litter box is. Things like that, just to kind of accommodate if we've got other issues going on, accommodate for those.
Yep. So from my understanding, when I compare cats to dogs and I look at this in particular, their cognitive functions, dogs seem to be a little more susceptible to dementia or things of, I kind of want to say memory loss to a degree, than cats are. But both of them basically do display the similar symptoms and things like that.
Yeah, I would say I generally see more dogs that are a little more confused, but it can happen to cats. Yeah. So feeding, one of the a senior diet is probably a little bit higher in antioxidants, things like that just help promote healthy brain function. So
yeah, that's actually a very good key point to note when it comes to doing nutrition. Does that drastically change too?
Yes. Yep. So you should always be feeding a diet that's appropriate for the stage of life that they're in. So those all life stage foods you don't really want to use, because a 60-year-old person and an infant don't eat the same. So neither should a senior cat and a kitten. So you just want to feed, a senior diet. Your vet will have a list of ones that they like best. And then the volume, you want to make sure it's appropriate for their size, if you want them to gain or lose weight. Going along with that, you always want a lot of water sources available, especially as they age, and you should get a cat fountain for your cat.
A cat fountain.
A cat fountain. They love running water. So, if we're in the early stage of kidney disease, like we're talking about, we want to really focus on getting enough water, and we will tell you to get a cat fountain. So.
Yeah, the hydration is very important for them to have access to it all the time.
Right.
Yeah. They get used to a routine similar to how what we do and what dogs do too. So when you're changing your environment up around, I understand when it gets stressful. There are a lot of clients, I'm sure, that would say, oh, just taking my cat to the vet is a stress inducing thing too. So don't let that part, though, hinder you in getting your cat to the vet, especially when they're a senior cat. We do want to reduce the stress that they're feeling. Thankfully, there are medications and different things that help with that.
Yes.
So using that as an excuse that I don't take my cat to the vet because it's too stressful, but your cat is at an age where they're more prone to these diseases that we're talking about today. And it's very important that they get monitored with the proper blood work, the proper exams, things like that.
Right.
Talk to your veterinarian through the phone, call your vet office and just say, hey, I know I should be looking out for these things. How do I safely and stress-free as possible take my cat to the vet?
Right, yes. And your vet will be pleased to give you medication to make your cat less stressed because it makes your job easier and it makes ours a lot easier if they aren't so debilitatingly nervous.
Yes.
So,
Yes.
there's different medications, different sprayable pheromones that you can, spray on the bed that's in the cat carrier and then just, acclimating your cat to the carrier before the trip to the vet is also key.
Yes, I highly recommend Feel Away. We've used that at the vet clinic before. And for dogs, Adaptil. I actually just used that the other day on the dog that we had here just to help release ease the stress.
Tension.
Yes,
Yeah.
yeah. Because I'm sure when it comes to like cat rescues, they get a new cat, no matter what stage of life they're in. And we're going to be talking about cat rescues later on in our show. We have someone from a cat rescue lined up to come on and talk to us about that. I'm sure she'll elaborate on this a little more, but in particular for senior cats, they're already going to be stress induced if they're a feral senior cat that's caught. So trying to calm their cage, their pen down, things like that. Do you have any recommendations for like a feral cat that's caught? Because if you think about it in this way, you see a stray cat and you're like, oh, I can't catch that cat. It's always going to be a stray cat. Well, then when they reach for their mobility, they reach that senior level and you're like, I finally caught that cat that I told you about 7 years ago. How do you deal with a feral senior cat?
A feral senior cat. Well, that would be quite a challenge. You could still use Feel Away, things like that. The cats, when they're stressed out, they're really kind of overwhelmed by auditory and visual stimuli. So, putting a towel over the crate, keeping it quiet. Maybe you leave the cat in the car until we have a room ready for you. Things like that. Trying to keep it very calm.
Yeah.
And probably avoiding barking dogs.
Well, speaking of which, by the way, if anyone is hearing in the background as we're talking, any barking dogs, we filmed this podcast live at the Wyoming County Animal Shelter. So we are going to be hearing dogs bark. I actually heard one of our clocks go off earlier that is a tractor clock. So at every hour, it's a different sound of a tractor. And we also have one that barks. So don't be surprised you hear one that barks inside our room here. So, yeah, but a part of that, reducing their stress and their anxiety. Another thing that we have on our list here to talk about is their vision, their eyesight. When they become a senior cat, whether they have diabetes or not, they get that cloudiness on their eye and the poor vision. Do you want to expand upon that and anything you notice?
Sure. Yeah. So, they can certainly have like age-related change, that normal hardening of the lens in the eye. Generally, that is pretty gradual, and so they adapt really well. They use so much of their other senses to get around and figure out where stuff is that they usually do pretty well. If you notice any drastic change, anything sudden, you definitely want to have that checked out by someone. And make sure there's nothing else going on. But yeah, certainly. And eye issues, we're told usually that when an eye is infected or there's an issue with the eye, get it seen as soon as possible by the veterinarian. Yes, yep. We don't like to wait on eyes just in case there's something bad going on in there. The eye's pretty sensitive organ.
Yeah. And so moving on from there, talking about dental care. So from my understanding, and please elaborate or correct what I'm saying or anything like that, but dental care, prevention is key when it comes to senior cats in particular, because we already talked about the stress level that they have when they go to the vet clinic and they're going to be poked, prodded, everything already. So taking care of them before they reach that senior stage with their dental care helps them for a whole slew of issues.
Yes.
And expand upon that a little bit.
Sure. Yeah, so in a perfect world, you would brush your cat's teeth using a cat toothpaste and a tiny little brush. You'd get in there and clean the tartar off every day, just like we clean the tartar off our teeth. A lot of people cannot do that, which is okay.
I'll be honest, I don't think I've ever tried.
Yeah. It's if you have a kitten and you can get them used to having their mouth handled, you can get a delicious tasting cat toothpaste. You can get them used to it. Apart from that, there's different dental treats that you can use. Those really help with the teeth in the back as they chew. Those crunchy treats help brush those teeth. There are supplements that you can put in water. Those don't seem to make a huge difference for most cats. So I usually focus on toothbrushing if you can, dental treats, or there are different dental foods which function the same as the dental treats. They're like big, crunchy pieces. So they help brush back there. Cats are prone to all sorts of different types of dental disease. Your vet might look in your cat's mouth and say, we really need to do a dental, which we have to do under anesthesia. We can't tell them to open wide and move your tongue over a little bit so I can see that better.
Hold still.
Yeah.
Don't move.
So, the more frequently we're looking in those mouths, addressing any issues, staying on top of things, being proactive, the less invasive we can be. So, maybe we do a dental on your cat and we just have to clean all the teeth. If we wait until we have a whole bunch of teeth that look very, very diseased, we probably will have to do more than cleaning and take some of those out.
Yes, that's actually that's one of the points I want to address too. I know just from my experience, mind you, I'm not a veterinary professional to a degree. I'm just a receptionist at a vet clinic. But receptionists, they kind of see and hear things every now and then. And from my understanding, for cats and dental disease, whether they're senior cats or not, well, actually in particular with senior cats, they tend to have a lot more of a dental disease where they have to be have teeth removed and sometimes full mouth extractions to a degree, depending on how severe they are.
Depending on, yeah. So there's a few different diseases. Stomatitis. Sometimes people have heard of that. That's that really inflammatory autoimmune component disease, and with that's the one you're mentioning. Often, most of the teeth need to come out with that. They can get this other type of dental disease, resorptive lesions, where the body is just kind of slowly dissolving the tooth. And that's painful, and those teeth have got to go. So always important to at least annually have a vet look at those sharp little teeth. Yes.
Yeah, and take preventative measures at all possible in any way you can. Yeah. Anything else related to the mouth or the teeth in particular that we haven't touched upon that you feel is important to address?
I think we've touched upon pretty much everything. Sometimes older cats are gonna, maybe they've had dry food their whole life and now they don't really want to eat it. Wet food might be your friend. Canned food might be a little easier for them to chew.
Yes. Yeah, and that it's good that you mentioned that too, because a lot of the not vet foods, but a lot of the pet foods that you have out there that you have a particular interest or a brand that you use or type of pet food, they usually have the wet and dry equivalent. So you're able to keep them within the same nutritional diet or the same what are the words I'm trying to... You're not switching.
Same brand.
Same brand,
protein.
the same thing.
Yeah,
Yes.
yeah.
Yes. That way you don't have to worry about potentially upset stomachs when you're transitioning food and things like that. Okay. So from our members. This is the opportunity part of the podcast where if you're a member of Animal Friends, you get the privilege to ask one of our guests on the podcast a question regarding the topic. So if you're not a member of Animal Friends, I suggest you become one today. Go out to our website, www.animalfriendsofwyco.com, and from there it will give you details and instructions on how to become a member. So Kim from Warsaw, she wants to know how do we help joint pain with senior cats.
With senior cats. Yeah, we touched on that a little bit. So step 1, keep them a healthy weight.
Yep.
Other things, joint supplements, different medications that your vet can prescribe for arthritis. And then as they're aging and they're, having a harder time getting up on stuff, providing ways that they can, jump on a box to get to the windowsill, things like that.
Okay. Yep. Awesome. That's good to know. Deanne from, Dina, my apologies, from Attica would like to know, what is the best way to introduce a new cat at home to a senior cat?
Okay. Very, very slowly over a long time. If you can have it so that the cats aren't even seeing each other initially, there is a closed door in between them and they're getting to sniff and smell each other's scent for, a couple of weeks. That would be great. And then you can do the thing where you trade out blankets so they're getting that scent. And then we move to they can see each other, but they can't get to each other. Once we're comfortable with that, then you could do some monitored time together.
Like a meet and greet.
Yeah.
Yes.
Yeah. And, space so that both cats have a way to get away. They both have stuff that they feel safe with or treats that they like. But yeah, generally way slower than you want is how you have to introduce cats. And if you rush it, it usually leads to an explosion of cats, and then you're back at square one. So as best you can, stretch it way out.
Yes. Try to keep that stress-free environment as much as possible for our senior cats.
Yes.
All right. Next question that we have is Heather from Perry. She wants to know she said her cat has gone blind. Is there any nutritional things that they can do or accommodations that they can do to help with the issues?
Yeah, so it would kind of depend on why the cat has gone blind. So if it was because of high blood pressure from hyperthyroidism, or if it's because of diabetes, certainly those are things we need to address. But otherwise, as long as the cat seems pretty happy and your vet doesn't find any other issues, just focus on maintaining that stress-free environment at home and not rearranging the furniture too much.
Yeah, yes. Yeah, and our last question that we have time for today, Val from Gainesville. She wants to know, when do we know our older cats are in pain?
Oh, yeah. So the big thing is when they are modifying their behavior to kind of deal with their pain. So maybe they're not jumping on stuff. Maybe they're not following you around. Maybe they don't want to be pet. That type of thing. They're very stoic creatures, so a lot of times they don't show their pain, but you can see it in how they're behaving. Yeah.
All right. Well, thank you so much. So in conclusion for our podcast today, I want to say thank you to Dr. Jenna Hill from coming on.
Me.
Yes, and thank you, Trisha, for joining me and being my co-host for today and beginning this endeavor with us. Do you have a special message you want to leave with our audience?
Oh, a special message. Yeah, so your vet can be super helpful to you in, these different stages of life for your cat. And there's lots of things we can do to kind of keep them healthy and prolong that beautiful relationship.
Perfect. Yes. And so Thank you so much for joining us for this. And Animal Friends at this moment doesn't have too many announcements or anything, so to speak. By the time this podcast airs, we'll be celebrating our 9th anniversary of Animal Friends of Wyoming County, which is really cool. And we're going into our 10-year anniversary next year in 2025. So that is fantastic. I'm so excited for that. We already have a couple events lined up thanks to Trisha and Rochelle, our events director. They're a great team, a dynamic duo of sorts. And so we have some amazing things planned and events for next year, including one right now around Valentine's Day that we're working on the details right now. So follow us on social media to stay up to date. Check out our website, and please share this podcast with a friend. Stream it on YouTube and Rumble, and check out our educational videos while you're at it. And if you want to give a tax-deductible donation, we surely do appreciate it through our website. Thank you so much for joining us today on this episode of Ciao. And thank you for Dr. Jenna Hill for joining us today.
Thank you.
Thank you. All right, everyone, have a good day.
Thank you for joining us on this episode of the Ciao Podcast, hosted by Animal Friends of Wyoming County. To learn more about us, visit our website at www.animalfriendsofwyco.com. And if you're interested in adopting a dog, please call the Wyoming County Animal Shelter at 585-786-8938. This has been a production of Knox Luna Films, LLC.